Go ahead.
Alright, so this one, your home for local resident for a man who's ill, and then you arrive to find a 56-year-old man laying in a recliner. Family states that he has been sick with flu-like symptoms for a few days. He started having difficulty breathing around 1 p.m. or 8 p.m. last evening and is now complaining of a slight chest pain.
Okay.
Do you want me to reread it or you good?
I think I'm good. I'll ask if I forget. I'll probably forget, but okay. So I have PPE on. Is my scene safe?
Yes.
Okay. Mechanism of injury, you said he had chest pain?
Yeah.
And he'd been laying there for a while?
Yeah, and it says he had been sick with flu-like symptoms.
Okay. I have one patient.
Yep.
I will think about ALS. As of now, I'm not going to call them.
Okay.
And then C-spine is not needed.
Alright.
Okay. So now we've arrived. Alright, so I'm going to approach the patient. Hello, sir, can you hear me? Yeah.
Yeah, he is responsive.
Okay, to both, like verbalization and painful stimuli?
Yeah.
Okay. So my chief complaint, or my,
Okay. I suggest hold on, let me mute Sherry.
okay, alright.
Oh, go ahead.
So my, impression of this patient, 66-year-old male, he's
56.
56.
If that matters. I don't know.
It's okay. So he's just kind of laying in his chair.
Yeah.
Has he had contact with anyone? Like, is anyone here?
Yeah.
Okay.
His family is there.
Okay. So his main complaint is chest pain and flu-like symptoms.
Yep.
So that's his chief complaint. And he said he was awake and talking. Okay. Now I'm going. Okay, I'm just gonna get a set of vitals.
Do you want anything more important than vital?
I should probably do sample history first.
Anything more important than that? You just got on scene. You want to check his
ABCs.
Yes.
Okay. So he talked to me, so his airway's patent. And then breathing. So if I were to listen to his lung sounds, would they be equal bilaterally and open?
Bronchi is heard in the base of the right lung, and otherwise his lungs are clear.
What was heard in his right lung?
Bronchi?
Bronchi?
Yes.
Okay. But the left one's clear?
Yep.
Okay.
It's at the base of the right lung.
Bases. Okay. So I know that he has some sort of fluid in his lung. So for treatment, I'm going to think CPAP, which is going to help with the lungs. So let's put on CPAP and see if that clears up that lung to help him breathe. If I were to look at his lungs, do I see any bruise, or not to look at his lungs. If I were to take his shirt off and look at his chest, would I see any bruising or anything?
No, there's nothing.
Okay. Yeah, so I would do CPAP, just for not that long, just to see if it helps clear it up. If it doesn't, we can take it off. Um, then I'm gonna move on to C. If I were to check his pulse, how would it look, or how would it be?
His pulse is strong and equal. And which pulse are you checking?
Radial.
Yep, strong and equal.
Okay. And if I were to check cap refill?
Half refill is, it actually doesn't say how it is, but considering he's old, I would say it's like 2 seconds.
Okay. And is there any major bleeding that I can see?
None.
Okay. How is his skin?
His skin is pale and unusually warm and dry.
Okay. If I were to take do we have a thermometer, correct?
Yeah, that's pretty sure we do.
Okay. Well, if we do, and I checked his temperature, does it say anything about temperature?
Yeah, his temperature is 101.2 Fahrenheit.
Okay, so he has fever-like symptoms. So my guess is he has some sort of infection.
Okay.
So I know that. All right. As of now, we know that he has bronchi. And does it say anything about CPAP helping that I can ask? Or not really?
Not really, because they use another sort of oxygen. So.
Okay. So I know that his lung is not equal with the other one. His skin was very warm and dry and pale.
Yep.
How is his oxygen, his SpO2 level?
Before you did the oxygen or after?
Let's do before first,
It was 92.
and then after.
And then after, it would be 96, but it's a different oxygen that you did, so where did that come?
Okay.
So they did it. I don't think it's something in the CPAP.
Okay.
It doesn't fit that.
All right. He might be in some sort of slight septic shock. With helping with that oxygen, he might have felt better after with the oxygen, but ultimately I think this is going to be some sort of infectious thing. So yeah, I'd put a blanket over him. Let's transport since he is older. So we're going to load and go.
Alright, and when you do the oxygen, the patient states that he has some relief of his difficulty breathing.
Okay.
So it is helps.
Alright, so we'll leave that on. Maybe we'll let's get rid of CPAP and let's just put on a nasal cannula at 6 liters per minute.
Yep.
Okay, so now we're in the ambulance. I'm going to start a sample history. Okay, so sign and symptoms he told me already. Any allergies?
No allergies.
Medications?
None.
Past medical history?
The only thing is 2 licenses for 3 days.
3 days. Okay, and last oral intake?
He can't remember, but he hasn't eaten much in 2 days.
Okay, and does he remember the events leading up to this?
Yeah, he was in the recliner chair watching TV.
Alright. If I were to ask him to describe his pain, if I were to ask him if he had any pain whatsoever, would he respond with anything other than chest pain?
He would say pain to the right side upon inspiration.
Okay.
And then it is dull, achy.
Dull, achy. Okay. And he said this happened about 2 days ago, his symptoms?
He has been having flu-like symptoms for 3 days, but the difficulty breathing and the pain happened like 12 hours ago at 8 p.m. last night.
Okay. If I were to ask him to take his finger and draw around the pain, where does it radiate to?
There is no radiation.
Okay. So he said the quality of pain was like dull and achy?
Yeah.
Okay. Okay. Um, so this is something to do with I'm going to say with mainly his respiratory, it sounds like.
Yeah.
Okay. Um, so I'm thinking maybe pneumonia, maybe some upper respiratory infection. Um, do you have another oxygen level for him?
Um, his SpO2 was 92 on room air, and then it increased to 96 with the oxygen, um, with the cannula, the nasal cannula,
Okay.
with 2 liters per minute.
All right. Um, I would say we should reassess him every. He seems pretty stable for now. Maybe let's just to be safe. Let's do every 5 minutes on the way to the hospital. Um, hmm.
I said okay.
Okay. So we'll do 5 minutes, and then just in a position of comfort. And then when we get to the hospital, we'll tell them that I have a 56-year-old male that's had some flu-like symptoms before this, about 2 days before this, and he complains of rhonchi, or it sounds like rhonchi in his right side. I added oxygen through nasal cannula at 6 liters per minute, and it improved from 92 to 96% for his SpO2 levels. Yeah.
Okay.
Um,
Is there anything else you'd like to do or have done before you got to the hospital? Anything you want to check?
so you said he didn't have any medications?
No.
Was he struggling to breathe, like using his upper respiratory muscles to breathe, or was he not really struggling to breathe?
When you look for breathing, you saw mild intercostal retraction.
And then with oxygen, was that about the same, or did they
That
deplete?
improved. That was less.
Okay. Um, I think that's all I can do for this patient is just to get him to the hospital where they can better treat him.